Now to our new medical series, Help Me Fix It. This morning, Dr. Richard Besser takes on a problem 80% of us will complain about at some point in our lives: back pain. Did you know it's the #1 reason people stay home from work? In an effort to get some relief, many are turning to surgery, but do they really need it? And Rich has some answers for us this morning.
That's right, Robin. This is a big problem. Each year, lower back pain costs an estimated $100 billion in medical costs and lost productivity. But surgery is not to be considered lightly. Here's one woman's cautionary tale. After Carmilla Billick's first back surgery, she thought she was on the road to recovery. What did you expect to have as an outcome from that surgery?
I expected to be completely better.
But Carmilla's pain eventually began to creep back, so she consulted with spine surgeon Dr. Edward Benzel at the Cleveland Clinic.
I had recommended that we work on the core strengthening exercises and the flexibility exercises. She didn't listen to me, and then she went and had another operation.
Because Carmilla met another surgeon who told her he could fix her back.
Everyone got lead?
At that time, I was just in so much pain, and he said, I can fix you through surgery.
There's a surgical cure for this.
He said I wouldn't have any more pain after he did what he had to do.
So she had the surgery, but the pain did not go away.
There isn't one day since that surgery that I have been free of pain, not one single day.
Like so many others, Carmilla was looking for a quick fix. Do you have any regrets?
I regretted that I got the back surgery. When you're in that much pain, you just want something done.
Today, the 56-year-old has the spine of a 90-year-old.
We need to be very concerned about the need to urgently do operations. The problem then becomes one of one operation leads to another, which leads to another.
Dr. Benzel says his office should be the last stop on the road to back pain relief.
When we hear about various surgical procedures, the perception is that these are the answers to our problems, and that is not reality.
The spine's anatomy is complex. There are bones, joints, muscles, ligaments, discs. Here's one example. When a disc between the bones of your spine bulges like this, it can compress the nerve, potentially causing debilitating pain. But surgery doesn't have to be a foregone conclusion.
First, try to do everything they can to keep from seeing the surgeon.
Things like lose weight, strengthen your core, and quit smoking. Carmilla wishes she had.
I can't, walk in a mall and hold hands with my husband like we used to when we first got married. I wish I would have taken all avenues possible to relieve the pain. That's what I wish I would have done.
To hear her story like that, Rich, there are many of us who complain about back pain, discomfort, and that. But how do you know when it's time to see a doctor about it?
Well, that's a really good question, Robin. I've had back problems my whole life. I've had a couple back operations. And there are times when you don't mess around. If you're having severe, excruciating pain, you need to see your doctor. If you're having any signs that could indicate a nerve problem, so if you're having pain that radiates down your legs, problems with your bladder or your bowels, leg weakness, or unusual sensation, those are signs that a nerve could be compressed. And that's something that you don't mess around with either. That's where you need to see your doctor and possibly a specialist.
Carmilla was talking about that she did see different doctors, but she didn't actually seek a second opinion after one prescribed a course of treatment. And she said she didn't want to hurt her doctor's feelings. We hear this a lot from people.
Yeah, we talked about it for a long time. Each time she would see a doctor and they'd recommend surgery, she would go ahead with it rather than getting another opinion there. And she's just such a wonderful woman. She didn't want to hurt their feelings. She didn't want them to think she didn't trust them. And I think that it's really, it falls to the doctors to welcome that and say, in order for you to move forward with this surgery, I want you to get another opinion, because there's a number of ways to approach this. But if your doctor doesn't say that, you really, as a patient or as a patient advocate, a family member, need to say, get another opinion.
You got to speak up, not
be
afraid to ask questions. All right, Doc, so tell us, how do we get some relief without going the surgery route?
There is no magic bullet on this one, but there's some things that are a little counterintuitive. bed rest is not the way to go. You know, it used to be bed rest and traction, but no, you need to get up and about. You want to do some exercise if possible. Use over-the-counter medications. Use them for like 3 or 5 days straight. Don't stop and wait for the pain to recur. You could try a massage or a chiropractic or physical therapy. That can help as well. And a heat wrap. You can go that route as well. Those things may help. If they're not getting better over time, see your doctor.
All right, help us fix it. Thanks, Rich. Thanks so much. So you had 2 surgeries.
I had 2 surgeries.
Okay.
On the web, you're going to find all kinds of tips here to help your back and prevent this.
You heard the doc. Go to our website.